Good afternoon. Thank you for joining us for today's Victors, Heroes, Wolverines event. My name is Matt Burrows, and I'm the Executive Director of Parent and Family Giving here at the University of Michigan. Today, we're going to talk about how the university is preparing for campus reactivation, a very important topic. I'm pleased to bring some of our leaders who can share the latest information about how we're working to deliver an excellent student experience and keep the community as safe as possible. You'll get to hear from Dr. Martino Harmon, our new Vice President for Student Life, as well as leaders from U of M Housing, Dining, and the University Health Services. We'll save time for questions at the end, but if you think of one along the way, go ahead and type it in the Q&A window at any time during the event. To begin our conversation, I'm delighted to introduce Paula Luptak. Paula is a proud University of Michigan alumna. She's the parent of 2 current University of Michigan students, a highly engaged volunteer, and loyal supporter of the University of Michigan. Paula, thanks for being with us. Could you go ahead and kick us off this afternoon?
Sure. Thank you, Matt. I'm pleased to be here today and eager to hear from our speakers. My name is Paula Luptak. I am a 3rd generation alum at the University of Michigan, and I am involved in the Mary H. Weiser Food Allergy Center, the University of Michigan Museum of Art, and the Maize and Blue Cupboard. I'm particularly interested in student support. I was shocked to learn that 30% of University of Michigan students struggle with food insecurity. The Maize and Blue Cupboard ensures members of the University of Michigan community, whether on a tight budget or restrained from getting to the grocery store, receive equitable access to healthy food. I'm delighted today to introduce Martino Harmon, who started as the University of Michigan's Vice President for Student Life on July 1st. A longtime advocate for student success, Dr. Harmon previously served as the Senior Vice President for Student Affairs at Iowa State University. Prior to that, he was the Executive Director of Student Success and Retention at Cincinnati State Community College, Dean of Student Development at Rhodes State College, Dean of Admission, Retention, and Student Life at Washita Community College, and held multiple roles at the University of Toledo. I am delighted to welcome Dr. Martino to the University of Michigan family.
Good afternoon, and thank you, Paula Luptak, for that introduction and for bringing us together today for a community conversation about our Public Health Informed fall semester launch. This is my first fall as the new Vice President for Student Life, but I also know that this is really a first fall for everyone in this virtual space as we all work together for a successful reactivation in an unprecedented time. They say necessity is the mother of invention. As you will hear from our Student Life team over the next few minutes, our planning for reactivation has inspired Wolverine innovation worthy of the Victors tradition. Student Life's reactivation plans are both innovative and collaborative. Our plans were developed with the institutional and academic partners across campus with a focus on preserving and delivering on our core work with students in all of their outside of the classroom engagement, whether it be in the physical space or the virtual space. Student Life's core work with students includes the following: community development. This means we ensure our students feel connected, engaged, and that they belong. Educational programming. This includes career development, leadership, and related interpersonal skills development. Health and well-being. Our work in this area focuses on promoting safe behavior and personal wellness. Student support, which involves assisting with emergencies and other related challenges. And essential services. This includes, for example, housing and dining, which you'll hear more about this afternoon. Our approach to this fall is data informed as we assessed and gathered insights from our remote experiences with students since this pandemic hit in mid-March. We also engaged in a vast array of student leader voices in our planning work, particularly in our efforts to develop the Wolverine culture of care. And that's meant to promote safe behaviors in the context of COVID-19. We've developed a reactivation plan that ensures both critical on-site services and support combined with virtual offerings to facilitate access and safe levels of density on campus in alignment with social distancing and related safety mitigation measures. Our plan also provides for calibrating to the public health guidance as the situation evolves. Our departments will offer programming that all students will have access to various opportunities such as service learning work through the Ginsberg Center, career coaching with the University Career Center, counseling through Counseling and Psychological Services, otherwise known as CAPS, and access to individual support from our Dean of Students team, as well as access to many other services on campus, including essential services. Speaking of essential services, I'm going to turn this part of the presentation over to Amir Bagdachi. Amir is a Senior Associate Director of Administration and Public Relations in the University of Michigan Housing Administration. He's been working with parents and new students in Michigan housing since 2010, and he has the honor of connecting with many families and parents through parent orientation. He is also a proud University of Michigan alumnus with a bachelor's degree in classical languages, along with graduate degrees from UC Berkeley and Cambridge in England. We are lucky he has circled back home to Ann Arbor. Welcome, Amir.
Thank you very much, Martino, Dr. Harmon. Thank you for that. And I have to say to everyone, I'm so excited. All of us in housing are so excited for the beginning of this semester. We know everyone is, but there's something very special about housing, where we spend these days in these residence halls meant to be filled with people, meant to have life in them. We spend all summer long working and thinking about every single day, how can we make this come back to life? How can we reactivate this place, which means so much. And really the moment is almost here. So I am so excited to share with you some of the things we've been thinking about, that we've been working on, a lot of the work that we're very proud of in cooperation with a lot of the partners that you'll be hearing from also today. But I want to back up a little bit. Before the pandemic started, housing has been around for about 100 years. And I would say there's three things we did extremely well in housing in Michigan. Three things we are extraordinarily good at. The first is caring for people's most basic needs, right? A warm, safe place that's your own. Then second, there's connecting people to community on an individualized way, figuring out for each person, how can they find something bigger than themselves to hook into, to get strength from, to define themselves in. And finally, cleaning bathrooms. Those three things are things that we are essentially unparalleled in, I think, globally speaking. And so when this national crisis has come along, this global crisis, it turns out those three things are exactly the three things we need to lean into, and we have lots of practice in. And while we're thinking about this fall as being a new thing, a new chapter, and it certainly is in the university, nothing's happened like it, the truth for housing is that, of course, we've been having students live with us pretty much continually since the pandemic really came to campus around March. So we have been actually practicing our protocols every single day. We'll have students continue living through us the entire year. So the measures that I'm going to talk about, we have actually been living into them, rolling them out, testing them, assessing them every single day. And that's really good to know. So here, that while a lot has changed, I think what's important is what hasn't changed. And when students are choosing to live with us, they're choosing that because of the value of the residential experience. What that means is they want a place of their own. They want to be able to connect with people. All those things that are the core part of that experience, those things are not going to change. And we need to be ready to deliver them. We need to rethink about how to do it maybe in some different ways, but some things are going to remain the same. Now, we also think about how are we going to manage this in this new environment. The truth is, what hasn't changed is what works outside the residence hall, right, and has worked successfully across the country, is going to be what works inside of it. The three basic pillars of wearing face coverings at all times in the public areas, practicing social distancing, excellent hand hygiene. We know those things work. And Dr. Ernst will tell us some more about how the university is thinking about it from a public health point of view. But those things work. And so our job in housing is how do we roll that out so they are everywhere where they can be in the residence hall experience? And I think that we actually have really solid plans, and we're, again, been living into them. So when it comes to face coverings, as you can expect, they are going to be a part of life. And already, while some of us may think that they're still a little bit different, they are the new normal. For our students, they get it. They're living with us every single day. And so they're going to be, face coverings will be required in public spaces in the residence halls, the hallways, elevators, lounges, kitchens, study rooms, some of the community bathrooms on your way to them. Now, what that means is, though, when you're in your room, that space is really your space. We can think of the room that you're in with your roommate as your household. You can think of it as your family unit. So no mask is necessary there. Really, you and that other person, you're in this project together. And so one of the very first things that we're encouraging students to do is connect with their roommates and have a really good conversation about what are the ground rules in this place? What are we going to do to keep each other safe? We know from experience that whatever your roommate situation is, talking about it ahead of time, and we can certainly help students do that, that really creates a solid foundation. It really matters a great deal. So in that room, that's your household. No mask is required. And most students will be in the classic double room. Some students may be in some larger ones that are very, very large, but the old school triples and quads, those are a thing of the past. They have been for many years. And especially in this year, most students will be in the classic double room or in a single situation. Now, of course, that room is theirs, and it is theirs to clean, right? So your student, when they're in this hall, they're going to be extra diligent this year, actually taking responsibility for cleaning that room with their favorite disinfectants and cleaners. We recommend they have a conversation. They bring what works best for them, have that conversation. But now once you're outside of the residence halls, some of those spaces, the ones that most people are concerned about, bathrooms, we will work on very, very well and very comprehensively. So what's going to happen is that our facilities team, and they've been already demoing this and getting ready and staffed up for it, they have a brand new protocol. It's the highest level protocol we have ever come up with. It comes directly from guidelines set by the CDC. And a lot of these things we've developed early on to handle other kinds of things like stomach bugs that come out. So we are ready. So we'll be in there with these brand new electrostatic sprayers with liquid ozone, which is an incredibly powerful cleaning agent, and brand new things that are specifically designed to tackle this unique public health situation. And our staff will be in there getting to all the high touch areas, the doorknobs, the light switches, the railings, the places where we know students are. We will be there multiple times a day because we know it's important, and we know families are expecting us to be there. So we are ready to go. We've got the stuff. We're going after it. Now, students on the way to the bathroom will wear their masks, but once they're in there, we ask that they observe good social distancing. And the truth is, actually, students do this already in any year, right? Every student knows, they quickly learn very early on, that if you're figuring out your time to go to the bathroom, you got to work out exactly your moment. So students naturally get in the groove of figuring out when they go. And we expect that we'll be able to work with that pretty well. We know their behaviors and what they need best. So as they go around the rest of the building, common space is very important. Some of the major lounges, especially the lockable ones, they will be off limits, especially in those first few weeks as we go in this with an abundance of caution and care. We really want to make sure we have a handle on things or are watching how things are going. But we also know students need some places to be. And we have lots of furniture around the residence halls. Students will see decals that note whether things have been socially distanced and advising them to sit here or there. There may be fewer chairs before, but still we know that students taking their classes remotely need places to be. Now, it may be a surprise to actually a lot of people, certainly my age, that students really, this generation, they're very comfortable sitting down anywhere and just having a video chat, having a class in the middle of a hallway. We've seen it all the time in non-pandemic times. So we know that this generation of students is comfortable with technology, comfortable with being in different public spaces and participating. So we feel confident about that because it's what we've seen work so effectively in the past. Now, we will look to open these lounges if we can as public health guidance evolves, and we always want to be reacting carefully in the moment to what students really, really need. So now plexiglass, you'll see, we're now familiar for a lot of us, a lot of basic service counters. Students will see that there, and again, all the decals where they can line up in place. Students will get used to this pretty quickly because it's happening in the rest of the world, and we understand how important that is. One thing is not going to change, laundry rooms. Laundry will always continue, and there's, of course, a special importance for it now. We know students are going to do it. We have special instructions up in all the laundry rooms to do it in a special, safe way. We view this as an extraordinary opportunity to teach this generation of students the value of laundry, one of those skills that many of us learned in college, but is somewhat of a lost art, one of the secret bachelor's degree that many of us acquired ourselves in our own time. Outside the residence halls, there's a team working right now on tents where students can, in good weather, find places to sit down and enjoy meals that Steve Mangan with Michigan Dining will be talking about a little bit later. But we know that giving them spaces, places to be, is really good for them. It's good for the mind, it's good for the body, and it helps them circulate around campus in ways that are safe and socially distanced. Now, what's going to make this successful is going to be buy-in. There is really nothing like students knowing that they have an important role to play. We are going to be crystal clear about the rules, and here's how we're doing it. So first of all, when you live in housing, it's actually built into the contract itself that when you choose to live here, there's some certain public health precautions, certain things you owe your entire community, right, that you're going to observe. So students will understand right from the very beginning, if they don't already, it's part of their contract and those first meetings with their RAs, that this is how we're going to do these things. And this is what the success of this year depends on. It depends on us. I want to say a little bit something about this because I know I read in the news about how college students are going to be and whether they're going to rise to this challenge. We know they are because students, more than anyone else when this first happened, were coming to us with ideas and leadership. They were the ones saying, this is how we need to do it because we want to come back. And the truth is with this generation of students, the new ones coming in, this is the generation, remember. These are the ones whose senior years really became disrupted in a way that they'll remember forever, right? These students who have a lot at stake in making this fall successful. They are going to make it work, and they're going to be a part of this community following these rules because they want to. It matters to them. They can see their own interest, both to themselves and to the community at large. And there's no substitute like that. You know that you're going to do it because it makes sense for everyone and for you. And the community is going to be looking out for each other, right? Everyone's empowered to step up and say, hey, we need to be doing this, and let's tighten things down a little bit more. Now, how do you make community there? How do you build connections? Right now, the RAs are in their classic August RA training. It's virtual this time, but that's what they're talking about right now. How do you create individualized plans so that each student can connect with someone? And that's one of the things that we're going to work on and try lots of different things because it's going to be different for every single student. But it is our job number one. And I'll get to it really when it starts in just a second, because right now I'm talking about move-in. This is the moment where we think of it as being a big deal for students. It certainly is. But for me, it really lingers in the memory of the parents, the families. This is the moment you've been leading up to in the movie in your mind, right? So our movement has always been a masterpiece of logistics. We said to ourselves, could it possibly improve? Impossible. Then they told us, do it, but socially distanced. And that we are going to do. So it all starts with this time slot system, which we have, again, down to a science. Students have signed up, and that tells us when the families are arriving, which means that we can actually get everything ready. We can have volunteers ready, blue bins ready, elevators ready, M cards, keys, all queued up. Families will arrive, they'll slide up to the residence hall, we'll wave them into the spot, we'll have our greeters there, an army of volunteers who will warmly greet you at a socially distanced way. And families can come in, one helper at a time per student, can walk in, get their key, get their own bin, which will lead to their own elevator that's marked for theirs for that time, and go through everything that's traditional in that move-in. Maybe a little bit different, maybe a little less dense, socially distanced, but the essentials are there. And what hasn't changed is that this is the moment for your student when it's going to feel so real. And for families as well. This is the moment when they're going to say goodbye, that is what they're working up to for such a long time. Those emotions don't change. The significance doesn't change. And what's not going to change is that we care so much, and that your student and the families will be able to look around and see, you know what, these people are really working hard on this, and they have a system down. So we really are excited to show off what we're doing in these halls, because we really expect great things. So with that, I know that may lead to lots of questions, and definitely you can contribute some in the Q&A. But I really want to think about, again, the most important thing is what hasn't changed as a Reactivate Campus. In the end, there are human beings here doing something, the first year of college, that is going to change their lives. It's going to transform them. Your students are going to come back different people, and they're going to be tougher, more mentally agile, able to do things that you never thought was possible. And that's going to be especially true now, because what it took for the students to get here was extraordinary toughness and skill. And that's what's going to serve them so well. And so with that, I'm so looking forward to answering questions and to seeing maybe some of you this fall. I'm going to turn it over to Matt. Thank you, Matt.
Amir, thank you. We always obviously appreciate your enthusiasm about the entire experience here at the university, so thank you for that. Following Amir, I'm very pleased to introduce to everyone Steve Mangan. Steve is our Senior Director for Michigan Dining. Obviously leads one of the nation's largest collegiate dining operations, which includes 9 dining halls and 24 markets and cafes across our Ann Arbor campus. His expertise comes from over 3 decades in the food service industry. He spent time as a chef and restaurateur, and has also had leadership roles in dining operations at 3 Big Ten universities now. So very pleased to have him here today to share some of the planning around meal services and other dining activities this fall. Steve.
Thanks, Matt. I'm really pleased to be able to share with what our thoughts are and how we're going to run our dining program this year. We can flip to that next slide. It's going to be some interesting changes. Just for fun, I put our mission statement up there. Mission Dining leads and feeds and contributes more than food, but to the education, health, and experience of our community and our students and the environment and staff around us. So we're more than just a dining program. We're engaged on teaching about the food system, supply chain, sustainability, our marketing programs. We have a lot of interactions with our students that go beyond the food. We can jump to the next. I thought I'd start with a quick review of what our residential dining program looks like. This is our dining system, our dining halls that consist of 9 different dining halls. We have 5 retail shops associated with them. These facilities are open to everyone with a meal plan. And actually any student that chooses to join us by using Blue Box for entry. Interestingly enough, this year, because we're de-densifying our operations, we're just making these spaces available to students only. Martha Cook and Law Club are 2 operations that will be running almost normally, because they're small and have limited population and aren't open to the public. We're able to really maintain our normal program in there, with the exception we've de-densified the dining halls. There won't be as much seating, and we'll be offering a lot of takeout opportunities in those areas. The rest of the halls will open up Sunday the 23rd for dinner, and through that week, for the move-in week, we'll be opening our operations as needed. We'll starting with the large dining halls at South, Mojo, and Bursley. And by midweek, we should have all of our operations up and running for as the students get into their home base and their res halls. Our regular hours begin Monday on the 31st. We'll have food available somewhere from 7 a.m. until 9 p.m. We've initiated a new contactless entry system. We're able to use a mobile app. It's called Get, just a simple G-E-T. If you go to the App Store on your phone and look that up, you'll see that. Check in with it, find University of Michigan, and you'll see you'll be able to easily navigate around the different functions on that app. Initially, we are going to be only open for takeout. As we see our systems start running in this new way of operation. As Amir alluded to earlier, we've been running our food system at South Quad all summer, so we've had time to develop our process, and now we just need to spin it up through the whole system. We're hoping to have an opportunity for dine-in available after some time. We have to wait and see if we have capability operationally, as well as if the public health rules will allow us to do that. And if and when dine-in opportunities develop, we've also initiated a reservation system, again, on that same app called Get. And then rather than have big lines form at the door, we hope to be able to have our students sign up for a mealtime. As Amir alluded to earlier, all the safety precautions are seamless from the housing environment into the dining environment. We're establishing one-way traffic patterns. We've got plexiglass barriers going up where they're needed. We're physically distancing. We've got all of our CDC recommended cleaning and sanitizing procedures. And then all of our staff certainly will be provided the PPE necessary, including face coverings and shields. Everybody be gloved. We've got pretty much everything you'd imagine that we would need to keep our staff and our students safe. Flip to that next slide here. You'll notice I've got our website, dining.umich.edu. If you do have some questions or want to keep in touch with what dining is doing, we have some FAQs up on that site as well. And we continue to update those as the situation changes. Now, interestingly, we're in all the dining halls, those operations, the 7 halls besides Martha Cook and Law Club will be takeout. We'll have multiple lines for those. So we're hoping to have a fast throughput. But additionally, we're setting up 5 additional distribution points across campus. We'll have one in the Central Campus Rec Building, North Campus Rec Building, and the 3 unions at Pierpont, the League, and the Union, Michigan Union, will have an ability to pick up pre-made meals with a swipe on your meal card, on your M card. And then that will also help us de-densify, increase throughput, make meals available where the students are. Those locations are open to the public. Staff can access those, and anyone with an active meal plan or Blue Bucks will be able to access those meals. The Blue Cafes, which are the retail shops associated with the dining halls, will also have a fresh takeout option. Again, those are just open to students only. And we've been very careful to make sure we pride ourselves on satisfying just about every meal preference you can think of, with both special diets, vegan, vegetarian, halal, gluten-free, and also cultural foods as well. We'll have our kosher kitchen will be operational, and those meals will be available only at South Quad Blue Cafe. We'll also have some of those distributed in our retail shops that we'll get to in a minute. So carry-out's available in every dining hall, and we still want to keep our connections with our students who may have some special needs around food, perhaps an allergy or some sort of health concern. And we have our dietitians ready to go and speak with the students that want to reach out to us. And you can reach out to us easily at eatsmart@umich.edu, and I guarantee you'll have a response very quickly from one of our dietitians. We can flip to that next slide. And the other piece that's really important to know, that we'll be providing 3 meals a day to any students that may find themselves in an isolation room as we move through the next few weeks in this semester. So that system is in place as well. Just for fun, I put out a sample menu that'll be at our outposts. Some might think these are pretty fancy, but we've got a real mix of cultural foods, plain foods, fancy foods, and hopefully some things that our students will find really interesting. I've been privileged to sample a bunch of these over the summer. Just for example, our lunch here, we have a salad every day that's interesting. Our entrees, there'll be 5 choices. This one's built up with a tomato and watermelon salad with shrimp. We've got a Hunan chicken with noodles. We've got a shirasi, which is a Japanese bowl of sorts. We made this one vegetarian. You usually see some tuna or something in it, but we've made this vegetarian. got a Thai broccoli and quinoa power bowl. And again, here's a plain thing, an Italian sandwich on multi-grain bread with some pesto potato salad. And then additionally, these takeout choices will have desserts and cookies and whole fruit and snacks. So it's not just one meal. The students will be able to grab quite a few things to take them through the whole day until the next meal. Pop to the next, please. I thought I'd speak a little bit about our retail and catering operations. These would be more appropriate for the student that may be off campus and wants to access our dining program as well. We'll be opening all of our 18 retail units. These are stores that are assortment of different concepts. We've got convenience stores, cafes, food courts, and restaurants as well that we serve quite a few meals out of on a regular basis. So our regular hours will resume on the 31st. We really are thinking that these hours of operation will be subject to change. If you want to look at this, please check our website again. At this point, we don't really know how many people will be on campus every day and who's going to be around to support these operations. So we will have limited capacity within each retail unit, but we will have a full product line offered. One of the innovations we've done to support our students and parents is to enhance the M-Gift program that we have and our Catering to Go program. These programs allow guests to order packages online. The M-Gift is set up to pick up the products at different locations across campus, but the Catering to Go has full delivery with it. And the gifts include snack bundles and lunch bundles, personal care items, sweets from the bake shop. As a matter of fact, we just met with the International Center, who are really concerned about the international students coming to campus and having a need to isolate or have some difficulties navigating Ann Arbor initially. So we were setting up a package that has personal care things, cleaning supplies for their apartment, and just those things that you need to get started, and some simple meals that they can eat for a couple of days without having to figure out what Ann Arbor's all about. The Catering to Go program, we're anticipating some students may bundle some orders together. Maybe they're in an apartment, order a bunch of food from us, and then have it delivered to their door. So we're looking forward to seeing if that might be helpful for everyone. Again, we've got our website to order an M-Gift for your student. Incidentally, we're opening a new burger shop in the Michigan Union. We've got local beef and sustainable things. We'll have a Beyond Burger choice for you. It'd be pretty interesting. And then we've got a new cafe opening up in the robotics building. So moving on to some of our programmatic things on the next slide. Michigan Dining has really been a leader in sustainability on campus for some time now. Where some might say we need to take a pause, we're going to continue to push forward with our initiatives around making sure we're procuring our food properly. We're paying attention to our supply chain, working with codes of conduct and ethical vendors. But one of the big things we've really been working on has been our waste reduction efforts. We're leading the university in moving our waste from landfill to compost. And we want to continue that effort. But this year, the waste stream is going to be changed dramatically because we're sending out thousands of takeout meals all across campus. So we're working with our campus partners to manage this. There'll be more recycling needs, more composting needs, and hopefully less landfill needs as well as we go through this. So we're looking forward to making that program work and have a great story to tell about that. As Paul had mentioned earlier, we do know that we have a food insecurity problem on campus. We'll be continuing to work with that. We've extended our hours to accommodate what we think will be an increase in need. We've been running all summer, and we've seen quite a bit of interest even this summer when there's been very few students around. So we're going to be very busy. Even on the cupboard, we've got our COVID restrictions are in place. We're investigating additional food access points on campus right now. The engineering department, this just a little while ago, put together what they called the COVID-19 challenge. And we had students from all over campus coming up with ideas for us to do a better job with distributing food across campus. ideas for dining and so on. And they've come up with some really great ideas for us. So again, we'll be increasing our hours of operation. We're looking at a reservation system for the cupboard as well, so we can reduce waiting lines and not have the students bunching up in large groups. We're also identifying programming opportunities for a distance engagement with virtual cooking classes and grocery shopping techniques and SNAP applications. And we'll continue to educate the campus community regarding the available resources offered through Student Life. We've got a great website for the Maize and Blue Cupboard. If you just Google Maize and Blue Cupboard, it'll come right up for you. And the latest information will be up there as well. Just wanted to close this with a couple thoughts on some of the challenges we have in dining. We work closely together in a dining operation, so we're really determining our staffing needs. Our biggest challenge is keeping our staff safe. So we'll be, again, working with the latest information from the CDC and our environmental health folks on campus. This dining in versus takeout is going to be difficult for us as we move through the fall, and we hope to get there as soon as possible. But again, we'll be working on that as we can with keeping that public health information at the forefront of what we do. And then we pride ourselves on what we think of dining as more than just a transaction with our students, but we hope to be transformational and teach them about how to eat better, explore new foods, think about how the food system is put together, think about how climate change and sustainability interact with our food system on campus. Think about how they can work with us in developing internships around marketing and public health and our sustainability work. So we're thinking about how do we enhance the communication with our students as they come and go. It's going to be a different relationship. We'll be looking at building up our social media presence. If any of you are interested in following us, please do. We have a presence on Instagram and Twitter and Facebook. And that's the front in our minds on how do we connect to the students in this new environment, not only just through the great meal that we're going to provide for them, but the learning that goes with the food system. So that's it for now. Back to Matt. Thank you for letting me share this with you.
Thank you for helping us understand how everyone is going to be kept well fed when they get back to campus here. Following up from Steve, I'm very happy to introduce Dr. Rob Ernst, who is the Executive Director, of the University Health Service, and also the Associate Vice President for Student Life, overseeing all of our health and wellness programs. That includes things like counseling and psychological services, which you heard Dr. Harmon reference earlier. We refer to it as CAPS around here. Our campus Sexual Assault Prevention and Awareness Center that we refer to as SAPAC, and of course the Office of Services for Students with Disabilities. So Rob obviously has a lot going on right now. In addition to that, he is Assistant Professor of Internal Medicine in the Department of Internal Medicine here at the university. He is also a practicing primary care physician, and I know that Rob was having clinic hours with his patients just before he joined us here this afternoon. So we appreciate him making the time to be here. Rob, thank you.
Good afternoon, everyone. Thank you, Matt, for that very nice intro. I'm going to share my slides here. In addition, I am an alumnus of the medical school at the University of Michigan and a parent of a University of Michigan undergraduate student and the parent of another prospective student applying right now. So deep ties to this great place. And it's been a really challenging time. And as we prepare for the fall, I've been very involved in the planning of the public health response and chairing at this point a campus health response committee. I'm going to spend the next 10 minutes or so going over some of the important work that we're doing in terms of executing the strategies that were put forth by a series of committees. There's a lot of names up here, really talented people I've had the privilege to work with. The approach for the university, like many, was to stand up a couple of really important advisory teams to take a look at our academic calendar, our academic offerings under the guidance of our provost. I think there was a previous session like this talking about those academic offerings. And from a public health perspective, the dean of our School of Public Health convened a committee that advised the COVID leadership team, which is essentially the executive officers, on what would be the generally accepted standard approaches to executing a residential university experience. Once those plans were sort of considered and then taken to the executive leadership, and we had the announcement of the plans for a hybrid type of model, then there became the execution. So then this group of folks, which includes members of the public health community, physicians from the Michigan Medicine, colleagues on campus in the environment, health, and safety area, who you heard about before, our occupational health services, the labs at Michigan Medicine, which we're so dependent upon as we're thinking about that critical piece in the puzzle, and then partners in student life and communications. Our role, and I don't know if this shows very well, is to really bring together all the relevant pieces to try and operationalize those recommendations from the Public Health Advisory Committee. We report directly to the president in this capacity, and we're really charged with keeping the executive officers apprised of the status of these various work streams. The work streams that we've identified include a really detailed approach on trying to, launch the fall. I'll talk a little bit about that in a moment. We're really beefing up our clinical assessment pathways, both for our faculty and staff and our students. Critical piece to kind of keep the state of the pandemic in check is a case investigation and contact tracing arm. I feel like I've done a sort of master's in public health over the last 6 months learning about these kinds of processes. We are implementing a surveillance strategy with surveillance testing. A really key piece is reporting, and as I was listening to these previous speakers, I was kind of flipping through the questions, and a lot of questions about triggers for when we would maybe make a pivot, and those triggers are going to be informed by the data pieces that we're following along the status of the infection. And then everybody talking about what's happening now. I, as a sort of clinician, want to make sure there's other things we can do to stay healthy as well. And I think one of the most important things is not to forget about the seasonal flu, which could really become a complicating factor this fall, depending upon the state of the pandemic, and really heavy emphasis on flu vaccination and the approaches that we're going to put in place to encourage flu vaccination will also sort of serve us well in the eventual arrival of a COVID vaccine. So as we talk about our fall activation, if there are other parents in the group, like me, they should be talking to their folks about really taking the couple of weeks now leading up to the fall to sort of enhance their efforts around social distancing. So I know there's a ton of discussion about testing, but a test is a one point in time. And as soon as the swab's taken, it's exposure that then is going to drive the likelihood of bringing infection to the campus. So I think really minimizing interaction with other groups, really trying to stay tight with the family unit, heavy emphasis on masking. I think this is really one of the best strategies. I just was talking to a colleague of mine at Tulane who has spent the last 17 days trying to wind up their campus of returning students, and they had a more comprehensive approach to sort of staggering the move-in, but they found that that their folks were really compliant with that, and that was what they felt was one of their best approaches. We have set forth an expectation for students to add an extra educational module before coming to campus. The students are used to the platform that we use as EverFi to push forward a number of health and well-being initiatives like alcohol and other drugs counseling, as well as sexual assault and awareness and healthy relationship education. So we're using that same vendor to personalize it to the University of Michigan campus, some of the things that we would hope students would really sort of stay vigilant about when they return to campus. Our Dean of Students and our Wolverine Wellness team, along with the Office of Student Conflict Resolution, really worked through the summer with student leaders across the campus to really adopt a set of shared principles to try and keep the campus safe. We've adopted what's been socialized now as the Wolverine Culture of Care, which is a sort of two-part series that includes a pledge of responsibility, personal responsibility, and organizational responsibility for those groups that students are part of, and then some accountability, both at the individual level and for the organizations that they're part of. And that is the commitment on the part of our students to say they want to be at the University of Michigan, and they know that this is not a typical fall. So the things that we have to do to maintain social distancing, adhere to the expectations for masking, and really be respectful of others and their risks is something that we'll have a chance to drill home. University of Michigan has a very sort of comprehensive masks on policy, and that's on all parts of the campus, indoors and outside. So we will be helping students with provision of face coverings with an expectation that they wear them. You know, the evidence is strong that masking prevents the person-to-person spread of this virus. If I've learned nothing else, I've learned that this is a very tiny molecular thing that really requires us for its survival. And it requires that we move it from person to person. And it's close personal contact that moves the virus and keeps the infection propagating within communities. A mask is an incredibly effective way to interrupt that cycle. So strict masks on is the best chance we have at holding the infection at bay. Students who will be living in university housing should already have heard from us, Dr. Harmon and myself, and expecting that they would complete a test prior to coming into our big residential halls. You know, I've heard a lot of questions about what about the other places? The other places, you know, we worry about it I for sure, but it really is the big residential halls where the risk of spread and the overwhelming our contact tracing capacity and our quarantine and isolation is where we our public health teams advise that we focus on. So we have about 12,000 people in housing this year. It's going to be lower than that. Many of the students are year-round. By the time we got to the folks during the usual move-in period, we've invited almost 8,000 students to participate in this plan. So they've already received a kit that they would receive at home, do a self-swab next Monday. Don't do it till next Monday, because doing it too early and doing it too late is going to miss the opportunity to identify those who are carrying the virus and interrupt their plans to come to campus. So that's the plan for students in university housing. We will be working with Michigan Medicine Labs to manage the early arrival folks in university housing, and our partner in Michigan Medicine Labs is going to help us with the other prioritization for testing as well. That's for individuals exhibiting symptoms and as part of our contact tracing and our surveillance plan. Our clinical assessment pathways are, as I mentioned, focus on the student arm. We do have faculty and staff that we've been tracking because we've had thousands of faculty and staff working on campus, you know, since the outbreak. That was mentioned before. I see patients at the University Hospital, and I just came from there earlier today, where the University Hospital has adopted many of these social distancing and masking strategies, and we've been very effective at preventing infection amongst our employees. And I actually feel really safe when I go over to the hospital. And the University Health Service, we've had a team of folks in our research enterprise wound up about 7 weeks ago. So we have had experience piloting and really implementing these social distancing approaches in our facilities. And for faculty and staff, we channel those folks through the occupational health arm at Michigan Medicine. For students, we've modeled our COVID hotline and assessment and testing pathway on that same kind of platform as occupational health, and have been really close partners. Some questions about how we're going to maintain access to that. We've added 2 triage nurses, we've added 2 other mid-level providers, and we've shifted some of the priorities for our care approach in the health service. So there won't be as much elective stuff for those first few weeks while we expect that there might be a demand for assessment for COVID. We've also expanded our telehealth. So this has been, you know, Dr. Harmon mentioned before, you know, there's opportunities come unexpected sometimes. So we have been kicking around telehealth for some time, and with the pandemic, we have really optimized the ability to take care of patients remotely. So we have expected students to call us first. You gotta call first, because then we can do the phone triage and then minimize contact between folks, both coming for non-COVID related things or for COVID assessments. Do it and then in a way that doesn't require that they're piling up in our lobbies. So we can sort out and do a lot of the evaluation and treatment over through our electronic health record, and then direct folks to testing. We've opened a big on-campus testing center at the Power Center. Is going to be our testing center, is sort of where we're going to be specimen collecting. So that's working out, I think, coming together pretty well. Our case investigation and contact tracing is something people are appropriately concerned about if we're going to be able to stay ahead of this. We've worked with our faculty at the School of Public Health to develop a model. You know, they're calling it a process map. I'll show it to you just for interest because it's super complicated. But the nuts and bolts is that it's a partnership between the Washtenaw County Health Department, the School of Public Health, and our environmental health and safety teams. And we're going to be working out of a COVID campus command center to assign any positive case to a contact investigator and pair them up with someone from what we're calling our contact tracing corps. We're right now posting and recruiting to take a minimum of 75 professional students and graduate level students to participate and help with the contact tracing and identifying people at close contact, and then get them isolated in quarantine space. Our partners in University Housing have identified 500 spaces that we will be staffing up as our capacity limit for isolation and quarantine. Not everybody necessarily has to be quarantined, depending upon their living situation. That's part of the contact tracing and investigation process, is identifying whether or not they could either go home to their permanent residence or stay in their current place, or we would accommodate them in one of these spaces otherwise if it was not suitable. This is that super complicated sort of process map for how we will be working together with the health department. I just put it up there because I find it interesting. Separate for both faculty and staff and for students, you know, and we're hopefully that's going to really work. For surveillance, we've got a several tiered approach for surveillance as well. We're expecting everyone to sign up for our symptom tracker. This is something that we've been using since the start of this. So all of our folks who are working on campus every day have just socialized going onto their symptom tracker every day. And it's right now sort of a web-based website, but we're having it converted as we speak. It's actually before the whatever it takes to get it in the Apple Store and the other store as an app that can be used on a daily basis. It's standardized, you know, answer these questions. Do you have cough, shortness of breath, fever? Yes or no? Do you have one or two of these others that are the most current case definition by the CDC? And then contact with anyone else. If you get no's across the board, you get a green light. And then if you get any of those others, both will show the screen red and give identifying information for what to do next. So you get to ask, you know, if you're a faculty, staff, student, it's used its Flint and Dearborn as well, so that we can help identify, you know, the appropriate numbers to call if there's any concern. In terms of our surveillance testing program, we're going to have an opt-in approach. So people who are interested in an enhanced level of surveillance, we're going to bundle this and expect that they have regular participation in the Responsive Blue symptom tracker, and then do a risk assessment depending upon what is considered their risk of exposure, to then go into a randomized screening approach. At this point, as of now, we expect that we'll have a minimum of 2,000 tests per week to include in this, but that's going to be, you know, adjusted based upon our capacity. The risk adjustment is going to be based upon, like I say, if it's a student who's in one of those, you know, departments that's more lab-based or performance-based, or they're just not amenable to virtual learning, that's going to be a different level of risk. If it's depending upon the living situation, it's somebody who's in a communal living as opposed to an apartment with one roommate or something like that. So there's going to be ways to kind of determine relative likelihood of being selected for a part of our selective surveillance. This is being conducted under the guidance of, we have a campus-based CDC surveillance lab. You know, it's typically the spot where we do influenza-like illness surveillance for the fall, but it's being converted over entirely for COVID level surveillance and under the direction of the School of Public Health. This is just part of the prompting and getting folks into this approach. And it does speak to, I know, a lot of questions about testing, you know, and I understand the anxiety that everybody's feeling for sure. And I know that people are hearing about different models that different schools have, and there are several schools that have much more widespread testing models than others. We have a partnership with our Michigan Medicine Labs, and we know that we have capacity for a certain amount of testing that has to be prioritized. And I think that the top priority is making sure that we get prompt access to anyone who's exhibiting suggestive symptoms of COVID and get that with a rapid turnaround. Our labs have been giving us consistently 24-hour turnaround, and we're hoping to even do better than that by trying to, we've actually obtained a rapid turnaround device for the health service, and now we're just in the process of validating and securing supply chain stuff. And this is really, really challenging because everybody's trying to do exactly the same thing. We certainly are investing heavily in our contact tracing and back-end close contact finding as a priority too, and then our, as was just mentioned, our surveillance strategy. Reporting's the next thing. We're going to be, you know, standing up a variety of different dashboards to know what's going on. And I mentioned before, if we're going to pivot, it's going to be based upon certain identifiable measures. So one of the measures is going to be what's happening in the local community. These are sort of what's happening right now. These are right off the dashboard where you can see, you know, back in March, we had a spike, and then there's that weird spike right when they tested all the people in nursing homes and prisons. And then we had a lull, and then we had, as the stay-at-home orders relaxed, we had more cases that then plateaued and have actually come down. You know, so this is something that we'll be watching the epidemiology of the campus as well as the region. And, you know, there are some agreed upon public health metrics, about 5 straight days of 3% growth, or, you know, unrelated 5 pockets. It's all being advised by our School of Public Health, and these are the same people who are advising the governor and the state of Michigan. Something else that's received some attention that we're going to be watching is the age distribution breakdown. Many people have picked up on notice that the with that sort of second bump was a higher percentage of younger folks, and actually that's even come down, the percentage of, with younger people. So, you know, we do have confidence in the fact that our students want to be on campus and they're going to conform with this Wolverine culture of care. So we talked about some of the things that we're working on right now. I've actually gone over all of these things. I'm going to end with just this. It's you know, I'm a former athlete. I buy into, you know, practice, and then you go out on stage. You know, the playbook here for me is this. You know, this is how you draw it up. You wear a mask, you avoid crowds, you maintain your spacing from others. That's how you don't let the virus trick you. It wants us to spread it to each other, and these are how you do it. To a lesser degree, surfaces are an issue, so I have no sort of qualms about hand washing and hygiene for sure, and the vaccination bit. We're going to be ready, you know, doing on-campus mass vaccination of flu, and we'll be able to turn that over to COVID as it becomes available. So I appreciate the opportunity to address this group. and looking forward to the fall.
All right, a lot of great information from speakers. I just want to remind you, and you'll hear this before we close, to really stay close to the maze and blueprint section of the website, as it contains a lot of information, because we know it's impossible for you to remember all of this. But as a new vice president for Student Life, I want to say it's really an honor and a privilege to join the Wolverine community of engaged alum, families, and colleagues. So I'm inspired to be here, and I'm inspired by our safe investment in this fall semester. I do want to mention, as I was looking at some of the questions that were coming up, I want to talk about the division's role in making sure that students are not feeling so isolated. Our departments all have a set of opportunities for virtual engagement, as well as some, in-person engagement with safety measures included. So we can connect students to other students. We can connect students to services. We can reach out to students who feel isolated and need help. So we have a lot of different techniques, and we got a little practice with this last March and April. So we will make sure that students have connections that they can make. The final thing that I want to mention is, you've heard about this Wolverine culture of care. If you haven't seen it, again, commercial plug, go to the Maize and Blue print section of the website. But it's really a student-led, and very impressive student-led and community initiative. And there's a part of it called the Pledge. And the Pledge really focuses on 5 key action items. I'll mention them very, very quickly. Monitor, self-isolate, and participate. Talks about testing, isolation, contact tracing, cover, distance, observe, gathering limits, washing your hands, keep your face covered, so forth. Wash, clean, and get the flu vaccine when it's available. Get it. Educate, innovate, and promote awareness. So educate self and others, and promote holistic well-being. That means observe all dimensions. One other aspect of the Wolverine culture of care, I think it may have been mentioned, it's responsibility and accountability. There's the accountability piece, and we have revised the statement of students' rights and responsibilities to include an addendum that allows us to address violations, or people who maybe aren't doing the right things. And we try to do that through education first. We try to do that through friendly warnings. But as things escalate, we can address it in tougher ways, but we don't really want to do that. But it's important to mention that. And there's all sorts of community partnerships. We have an ambassador program that's being launched, and it already includes students, but we're getting faculty and staff volunteers to go out there and provide that education, but also be the eyes and ears. So a lot of things in place to help keep the campus safe. And I just wanted to make sure that I shared that. So again, stay close to the Maize and Blueprint. And I want to thank you for your investment in our community shared work during this unprecedented and challenging time. So I'll leave by just saying, go Blue.
Fantastic, Dr. Harmon. Thank you. And thank you to all of our panelists for being here this afternoon, and to all of our participants as well. We've got a huge number of questions here. I know we're not going to get to all of them, but we will try to get to some of the more frequent ones here. Amir, unsurprisingly, I think I'm going to start with you. One of the more common questions, and you and I know this has been coming up, number of students who were originally assigned to one of our residence halls with a roommate are now finding that they do not have a roommate assigned to them. Can you just talk a little bit about how we're going to work through that, and what the students might expect to see happen there in that situation, please?
Absolutely. So that's something actually we're working on right now. The students coming in this year have until August 14th, so tomorrow, to let us know if they're coming or not. So as you can imagine, this is a really important decision. We're not rushing anybody because we want them to have the information they need. So once we actually find out, really being next week, who's coming and who isn't, we'll be able to make changes, and in some cases still place students who are waiting for housing. So in the case of a roommate who's not appearing, you might get a roommate, and that person's name will be posted as early as possible in the housing portal where your student checks out their contract. But in many cases too, it could be the case that that space will remain empty. And of course, that means that your student will be, if they're in a double room, will continue to pay that double rate and still be in a community, a comfortable community of lots of other students there.
Terrific, thank you. Rob, I was trying to peruse the questions, so forgive me if you touched on this already, but could you talk just a little bit about flu shots? Because again, that's something you've been keeping my team and I updated on. Is that something that we're going to be in the position to offer as a service to all students once the time on the calendar is appropriate to be doing flu vaccines this year?
Yeah, we are. A big plug for flu vaccination. You know, I know every year people try to gain, sort of time when's be the best time to get a flu shot. I know if people think that maybe the flu season will be later, they want to get it a little bit later. This year, I'd say get your flu shot as soon as you can. If it becomes available near home, go ahead. But once you get to campus, we're making it available at no out-of-pocket expense to students this year. You know, we've over-ordered and hoping that we can get rid of all the flu vaccine by going out on campus and doing distribution sites on campus where near the students and at the health service. And we're partnering with Michigan Visiting Nurses to go out on campus to do the same. So we are going to try to make a lot of movement on that as soon as it becomes available. So we think that'll be an early September activity. We haven't heard when we get it yet. It hasn't become available yet, but as soon as we know, it'll be a high priority.
Fantastic, thank you. Steve, a couple questions I'm seeing as I scroll through. Could you maybe please just clarify for us precisely where, a couple things if you could address, precisely where students can use their Blue Bucks throughout the system, whether that's only the cafes or if they can also use those in the dining halls. If you could talk a little bit about students not living in our residence halls, what options they have to access the dining halls via meal plans, if you could touch on those, please.
Yes, thanks. The Blue Bucks are available at every Michigan dining operation. So all the dining halls, all of our retail shops in the unions and across campus. They're also available to use the non-university vendor partners at the union, like Panda, Sweetwater's Coffee, et cetera. So they're the universal currency for just about every food operation on campus. They're also work in the bookstore as well and a couple other places. Off-campus students can access, again, all of our operations that same way if they have a Blue Bucks on their M card. And we also have voluntary meal plans if you want to buy a bundle of meals as well, that they can, they're built around a combination typically of meal swipes plus some dining dollars, which are virtually the same as Blue Bucks, but they only can be used in our operations on campus. I hope that clarifies it.
Thank you. And could one of you, I don't know who I want to toss this to, Dr. Harmon, you may want to touch on this a little bit, or Rob and Amir, you may want to jump in here as well. What are we doing? Obviously, we have a number of our students living off campus in the fraternity and sorority houses. Sort of what's our thought process there in terms of, how do I want to say, encouraging proper behavior, social distancing? How might we, Rob, assist those students with testing should that need to become necessary? Just if you could talk about how we're going to assist the students in the fraternity and sorority systems in general.
I'll start with the behavioral aspects of that question, and I'll leave the medical testing to Rob. So as I mentioned, the statement, Student Rights and Responsibilities Addendum allows us to address behavior, but actually the student leaders in the fraternity sorority community that are part of the councils, the governing councils, they are very much in the forefront. And for example, they have already stated that they will not approve any large or just regular sanctioned activities. They will not approve them for the fall. So they're already sort of being involved front and center, but it's really about, again, the culture of care, the rights and responsibility addendum. It's about the ambassadors. It's really engaging the student leaders. In all of the behavioral aspects, it's really the best, most effective way is for students, peers, to really help with their peers. We need students to step up and help us with that. I think maybe Rob can cover the testing.
Well, I think, again, I've talked about testing as a prioritized, structure. And we have, high priority for evaluating anybody exhibiting symptoms. And, that's going to be our biggest priority. I think that I would consider that, people living in those sort of group kind of settings, a higher risk situation. So I think I'd encourage them all to participate in the surveillance plan that we have put out. There's not a specific fraternity and sorority plan like we have for housing because of our sort of recognition of their self-governance there, and for our sort of concern about the much bigger sort of arrangements in university housing. I know our fraternity sorority Life Office is working in close consultation with the leaders, not just on the behavioral piece, but also in a harm reduction approach in terms of adopting the social distancing standards. I think it's going to be a real opportunity to demonstrate that leadership to execute the strategy there. And I'm really counting on the leaders in those groups to coach that up.
Apparently I am muted. There we go. Steve, I'm sorry, I missed one that I wanted to ask you to cover briefly a minute ago. In terms of when we actually start moving here at the end of the month, there's a number of questions around precisely what meal service is being offered at that time. So can you just please clarify for us during move-in week, during welcome week there, when we start bringing the students back, what can they expect in the dining halls? And if we're not serving 3 meals a day, what other options might the students consider?
Yeah, meals start Sunday night, the 23rd. They'll be available at South, Mojo, and Bursley. On the morning of the 24th, we will then move into 3 meals a day that week at South, Mojo, and Bursley. There will be meal periods that the move-in week. And during the week, as students populate the different residence halls, we will be adding capability at the smaller units during the week. I don't have the exact schedule at the top of my head here, but we'll be, I think by Thursday, we'll be fully implemented. And again, that whole week of the move-in week will have meal periods with limited times where you can get your meals. But there'll be breakfast and lunch and dinner 7 days a week. And then the week of the 31st on Monday, we go to all-day service. Starting at 7 o'clock at the large units. Some of the smaller ones will close at 8. The large ones are open till 9 o'clock in the evening. 7 days a week, right through the end of the semester. So as long as there's students on campus, we're going to be fully functional as a dining program.
Fantastic. Thank you very much. I would like to take this opportunity again to thank all of our panelists, Dr. Martino Harmon, Vice President for Student Life, Dr. Robert Ernst, our Associate Vice President for Student Life, Amir Bagdachi from University Housing, and Steve Mangan, our Senior Director of Michigan Dining, along, of course, with Paul Luptak, a great Michigan friend and Michigan parent. I would like to thank our team at University and Development Events for organizing a terrific event for us today. We hope this has been informative for all of you attending. As a reminder, we have recorded today's session, so we'll be posting this for future viewing should you choose to share it with your student, and that link will be provided to all of you via email tomorrow. So again, on behalf of the University of Michigan, thank you for being with us today, and go Blue.